So we're here at Riverview Hospital. It's a pretty amazing place. It's been around for more than 100 years. The building behind me is West Lawn. It's the oldest of the buildings. It was the first building built. It was built in 1913, and as you can see, it was actually mothballed effectively in 1983 and never maintained since then. So you can see the damage that the years have had on what was a magnificent heritage building and really has lost all of its heritage value. You see, we're in an arboretum that's quite magnificent as well, but some of the trees that are also 100 years old have failed. They've hit storm damage, and there's a chainsaw right now cutting them up and trying to maintain a little bit this spectacular arboretum, this wonderful grounds. You see the building that has failed, the building that is of no value anymore. We have other buildings on the site, though, that still have an awful lot of use left in them, many years of use left. And the building right in front of us, this is Center Lawn. It was built in 1924, and it was the longest used building, the longest occupied building on Riverview. It actually was used until 4 years ago with patients. There's a further building about a half a kilometer away. It's called East Lawn, built in 1930. The one that's used the most for the film industry, because that's one of the main functions right now here on Riverview, is Crease Clinic. Crease Clinic was built post-war. In 1948 it was completed, and it was primarily built for those people returning from the war with what was called shell shock then. Now it's called PTSD. And many of those veterans were treated for years in that really spectacular building. And today it's used primarily by the film industry as a university, as a justice building, as a penitentiary, any number of roles that it plays in film. Riverview has more than 100 buildings, and the buildings are ranging essentially in age from very new buildings, there's 4 or 5 that are built in the last decade, to buildings that are now failed completely. We here in Coquitlam have contemplated how we could possibly use Riverview's buildings, use Riverview to continue the long-standing role that it played in mental illness. Mental health and addictions is one of the big challenges we have today, particularly with the fentanyl crisis that really has changed the context of mental health. It has made it so that the level of urgency is so much higher. We had a report drafted by a couple of years ago here in Coquitlam by Dr. John Higginbottom. Dr. Higginbottom used to be the vice president of Riverview Hospital and worked for many years here. The report he proposed was that one of these spectacular buildings, and it was actually this one that was his recommendation, Center Lawn, could be used to treat those with severe mental health and addictions, the SAMI population, significant mental health and addictions. He proposed that we take these buildings and identify one that can be repurposed for a population that is really struggling right now. Fentanyl has taken more than 900 lives in 2016, almost 5 a day that die to this horrible drug that didn't exist a decade ago. So we in Coquitlam are hoping that the provincial government will contemplate really a significant expansion of the treatment options. To their credit, they actually have started already. There are 2 buildings here on Riverview, Hillside and Brookside, that have been repurposed in the last couple of years and now house people and treat people with mental health and addictions, and do it very successfully with Coast Mental Health. There's another 2 buildings that are currently under construction. They're breaking ground to replace the Burnaby Centre for Mental Health and Addictions at Willingdon, but also to replace the Maples Adolescent Mental Illness Treatment Centre, again for addictions, and the Provincial Assessment Centre. We think that those are really important initiatives. We really believe that Riverview Hospital could regain a critical mass of state-of-the-art mental health and addiction services, really regaining part of the role that it played in a different era. This was built as an asylum. This was built in an era when we stored the mentally ill. But with the introduction of antipsychotic and psychiatric drugs, it was possible to move mental health treatment back into the community. And that worked for many, but it failed many. We believe now that there is a role for some institutional care, and we're looking to the province to contemplate whether some of that could be here at Riverview, with repurposed buildings, renovated buildings, but also with the new buildings that are under construction. My name is Richard Stewart. I'm Mayor of Coquitlam, and we're standing here on Riverview, the Riverview Hospital lands, 240 acres of spectacular heritage buildings and arboretum and forests. 240 acres that has been dedicated for 100 years into the service of British Columbians who have mental illness and who have addictions. We've called on the provincial government to contemplate re-establishing one of these buildings for the treatment of addictions here in the province, and really re-establishing mental health services on the site. My family faces mental health issues, and we know, as many families do, the challenges with mental illness and addictions. We in Coquitlam want that kind of service to be re-established here at Riverview Hospital.